Hello everyone and welcome to another episode of Ask an Expert. Today's topic is about fertility. Dr. Guy Fender is with us today to discuss our questions. He is a fertility medicine and gynecology expert at AlFardan Medical with Northwestern Medicine. Dr. Fender, welcome to Ask an Expert.
Thank you very much for having me today.
We are very happy to have you. Dr. Fender, if we could have some briefing about your experience.
Okay, I did my training in the United Kingdom, my subspecialty training in Cambridge, and where I also did my research. I have a long experience in gynecology and IVF, and most recently working in the United Kingdom in the Southampton clinic with the Fertility Partnership before I came to join the new unit at AlFardan.
Dr. Fender, we noticed that fertility or infertility has become a very common problem nowadays. My question is, what are the causes for infertility in men and women?
Okay, well, it's very interesting you say men and women, because we now know there are more reasons for male infertility. And that's more to do with environment as well as lifestyle,
yes,
and rather than disease. With women, it's to do with environment as well to some extent, but also lifestyle, the stresses of everyday working, and also difficulty with ovulation. So the 4 ingredients that are necessary for fertility are good sperm production, good egg production, and fallopian tubes, and that normal anatomy that works, and normal sexual relations.
When do you think is necessary for one to seek medical help with fertility?
Well, if a couple know that they have a problem, for example, pelvic pain, that might be because of infection or inflammation, such as endometriosis, then a woman should seek advice within 6 months of trying for a baby. Because there's a good reason that may need to be treated, and one that we can overcome with fertility treatments. Likewise for men, if they have any concerns, for example, if they've had surgery in the groin area in the past, then they can come for a simple test to see if they have normal sperm production.
What about the bad habits that could cause infertility?
So bad habits are to do with lifestyle principally. Smoking is the principal one, particularly for men and for some women, and that includes shisha.
Okay.
So we have to be very cautious, and when patients come through for treatment, we say, please, absolutely no smoking. Alcohol is a no-no as well, although moderate amounts aren't forbidden.
But not excessive amounts, right?
But definitely not excessive amounts. Nutrition is super important, particularly for men and women to have a normal diet, but one that promotes fertility is one that is high in fish oil content. That's very good for sperm and egg production. With men, we encourage vitamin supplements as well as women, which include rare elements such as selenium or magnesium to improve sperm production.
So these are the things that improve the health so that the treatment could help more.
That's right, and it has to go hand in hand with lifestyle modification.
Such as?
So trying to ensure that you're not in a high stress environment at work or at home. Give time to yourselves for exercise, which is mutually beneficial, something that can be done together, such as simple walking for a minimum of an hour a day.
Wow.
Be very good for your mental health and great for your metabolism. Monitoring your weight so that your weight is optimal for your height. Doing exercise in addition to walking. A lot of people take extreme sports out, do cycling or running. All of those are great, but only in moderation. So not too much cycling,
Not too much.
for example.
But you mentioned something about mental health. Does that have an effect on fertility itself?
It is profound, actually, particularly for women, because stress can lead to a change in the menstrual cycle. And the menstrual cycle is all about preparing the womb for ovulation and the possibility of fertility and conception.
Yes. you.